Hey, familia, welcome to In Your Business with Dr. Alex, where we get all up in your health and your business. And today I have an amazing guest, Dr. Teresa Fuller. We're going to call her Dr. T today. And we're going to be talking about children, our children, right? Our children, obesity and nutrition, and what a huge problem childhood obesity has become and what we can do to start addressing it in a holistic, in an integrative way, because that's her jam. That's everything that she's about. So I'm going to definitely bring her up onto the stage here shortly and let her introduce herself and her background. And we're going to get into this discussion. So we are on YouTube, Facebook, LinkedIn, Twitter. We are in all the places. So please drop in the chat where you're joining from, who you are, what you got going on. Definitely use this time to connect and network. And this is interactive. It's meant to be a discussion amongst us. So feel free to drop your questions, any questions or comments, drop them in the chat and we'll bring you into the conversation. I love that. So before we get into the show, I'm going to give a quick shout out to our sponsor, Mr. Eric McKee. He has been an amazing support of the show and he helps us bring amazing content and guests like this to you. So we're going to put his info up on the screen here. Just one. All right. And we appreciate him. And if you're in Northeast Ohio and you're looking for a realtor, definitely reach out to him. So without further ado, I'm going to bring up my amazing, excuse me, I'm getting all choked up over her. Bring up my amazing guest, Dr. T. Dr. T, welcome.
Thank you. Hi, Dr. Alex.
Hi, hello. So Dr. T, definitely tell us a little bit about you and your background and what you're up to.
Thank you. Well, thank you for the opportunity to be on your podcast. I'll give you a little background on me. I've been practicing pediatrics for about 20 years now. But what really is what the most exciting part of the journey, I guess, would be is about 10 years ago when I got involved in integrative holistic medicine, which is what we're talking about today. So, the first part of my career, I did some really standard emergency acute care pediatrics, which I loved. But I started to learn about the power of nutrition and lifestyle on health more as a personal journey. And that started about, like I said, 10, 12 years ago. And once I started to really learn about the importance of nutrition and lifestyle and how it affected my own health, then I really started to delve into how does this affect my patients? And, how does this relate to pediatrics and children's health? And so that has been what I've been really just learning about and teaching and practicing for the last 10 years or so.
Wow. So have you seen kind of in your practice, have you seen an uptick of childhood obesity, of problems that is really like making you be like, this is something we need to focus on?
Absolutely. So, and the numbers bear that out. We have seen a progressive increase in prevalence of childhood obesity over the last 40, 50 years. Mm-hmm. And now, even since the epidemic, it went up another significant notch. So we're looking at a prevalence of about 19% of kids with obesity in the US. And so obviously that means with about 1 in 5 kids having obesity, that means I see it a lot in my practice for sure. And it's a complex problem. It's definitely a challenging problem of always trying to figure out good ways to help families when they're dealing with this. But yes, I see it quite a bit going up.
So how would you classify a child as obese or having an issue with their weight? Because I know this can be like such a touchy subject, and like I even throw myself into the mix when I talk about this, and that's why I talk about it so freely so much, because I was very overweight as a child. I was overweight as a child, and it definitely caught up with me because as an adult I was still overweight. I had high blood pressure, I was pre-diabetic, I went into heart failure. Like, I had all kinds of issues stemming from being overweight so long as a child. And so I know, and actually I was just talking to a client about this the other day, but the language that we use when we're dealing with children and we're talking about their weight. And I remember I was maybe like 13 or 14, and my mom had taken me clothes shopping, and we were getting ready. I was in an orchestra, and so we had to wear the white top and black pants. And so my mom took me to more of a dressier store, and I had to get these pants. And I'll never forget, the woman who worked there looked at me and looked at my mom and said, "Well, what size are we looking at? Does she have still some of her baby fat?" And I'll never forget that she said.
Mhm.
And and I know, we as our parents, sometimes we as parents, I've got 3 kids. We look at our kids, and sometimes we don't always see what other people see from the outside. And so how do you classify, or what do you consider obese as a child? Like, what does that look like? What are things that maybe a parent could objectively, like, from listening to, look at their kid and be like, oh, maybe there is a problem here?
That's a good point. And your story really brings to bear the problem that we have in trying to deal with childhood obesity, because you want to um, address it is so
Mhm.
important because it's going to lead to a lot of health problems, as you indicated, problems like some of which you dealt with, the
Mhm.
prediabetes, some heart disease, things like that. So we
Mhm.
have to address it and we have to work on it. But at the same time, there is that stigma that we don't want. We don't want children to feel labeled. We don't want them to feel bad about themselves. And
Mhm.
so that does make it difficult. There is an objective measure of obesity, which is the body mass index. Most people are probably familiar with that by now. And so when they come into the office, we're looking at that number.
Mhm.
But of course, parents don't really, they're not going to be measuring that at home. Usually the parents are the ones, oftentimes they bring it up because they will
Mhm.
notice that their child seems to be gaining weight rather rapidly. So
Mhm.
while we may look at body mass index as an objective measure, but more so than that, I usually talk to parents about how fast their child may be gaining weight. Now we
Mhm.
can see, because that's something easier for them to see. Wow, they gained 20 pounds in the past year. We need to slow this down because if this continues, we could get into some trouble with um, you know, diseases and things like that later
Mhm.
on, and even not too far distant. I don't want parents to be thinking this might be when they're 40 or 50. This could be when they're late teens or early 20s. So it
Mhm.
is an urgent problem that we want them to think of. So what parents are looking for usually is something that parents are already seeing. They're just seeing that their child may be gaining weight very quickly, or they may just subjectively look at their child and think they look a little overweight,
Yeah.
and we go from there.
Mm. Yeah, I remember in school, many, many years ago in school, and we were just diving into the cardiovascular system. And I remember one of my instructors, and this is just how powerful, like, people people's roles in your life, you don't realize till later on, like, how powerful, and things that people say too, that people say that stick with you forever, just like that baby fat thing. um our teacher stood up in the front and she said, why don't we have a pediatric section to this cardiovascular stuff that we're going to be talking about now? Why is there no peds section? Because every other thing we had a pediatric and then an adult. She's like, why is it for cardiovascular? And nobody could answer because we're all new. We didn't know. And she goes, because so many of these heart conditions, these cardiovascular things are acquired over time. So kids really aren't born with a lot of these issues, but they develop them. And so that's why we see them into the teens and into young adult and then into older adult. So that's why we don't have a pediatric section. And that always stuck with me going through my career. But then, like you and I were talking about just before we got on here, with me, most of my background was all cardiac ICU. That's what I did for like over like the last decade that I worked. And it was younger and younger and younger patients coming in for open heart, coming in for valve replacements, coming in to get, heart casts and stents. And it was like younger and younger and younger. And I'm like, what is happening? But then, like I said, I kept seeing these younger and younger patients, and then their children would come to visit, and I would see the kids overweight, eating chips, drinking soda, just sitting around on their video games. It just, that cycle, it was just repeating itself. And I was like, boom. And that's how, what really kind of prompted me into taking this into my own hands as well, and leading into what I do now. But, it's, kids are, we have, I don't know, this might actually go into our next section. I don't want to overstep and go to too many places. But when it comes to families, and so let's talk about kind of the family's role, and how do you address the family's role, and how do you talk to the parents when this starts to come up?
Well, that's critical, that it is a family affair. Every
Mm-hmm.
once in a while, I think most families understand that, but sometimes parents will say, I keep telling my child, I keep telling him, don't eat this. I keep telling him. And that's good. That's important information, but also it needs to be the whole family. So it should be that we as a family are not eating this, or eating more of, making more healthy choices. And so I do try to encourage my parents, you want to make this something the whole family is doing, rather than isolating the child and putting the responsibility of um, healthy eating just on the child. Because face it, all of us are the same, in a way that if we have something that is hard to resist sitting in the pantry, we're not
Mm-hmm.
going to be able to resist but for so long. And so I really encourage parents, make your home the environment that you want your child eating in. Make sure you don't have the things you don't want them to eat.
Mm-hmm.
um, that sounds pretty straightforward, but that's not always the case. Oftentimes there might be another family member who wants to have their snacks or whatever.
Mm-hmm.
And sometimes they're trying to hide it from the kids. It just doesn't work. The best thing is set up your environment to win. So let's have the whole household working on this, modeling from the parents, and setting up
Mm-hmm.
the environment with not having all of those chips and sweet snacks. One thing I tell my families is, have it at certain times. Everybody's going to want to have their snack. You're going to have your times where you're just, letting your hair down, eating your chips or your candy, but make sure that's not always there. You can say, okay, on the weekends, we're going to get our snacks. And then when it's gone until the next week or until 2 weeks from now. That's a great way to control it. You're not really stigmatizing the child. You're letting them have access. And then when it's gone, it's gone. So those
Mm-hmm.
are things where you're really setting up your environment, you're modeling, and it's a family affair.
Mm-hmm. Oh, yeah, I love that. That's one of the things that I talk about so much is environment as well. And it's like, how are you setting up your environment for success, or for all these opportunities for excuses and friction, and setting yourself up for failure, for eventual failure, because you're making so many, you're just putting it there and making it so hard on yourself, when the environment, it's easy to curate an environment for success, but then the environment also is such a product of our habits and our routines, and something that we set up so unconsciously. And that most of the time we just carry and continue what we learned. We just carry that into adulthood, and then it's that same, like we talk about, that same cycle over and over again. But that's also my biggest piece of advice to people, adults, is your environment is everything. Your environment is everything. So
Yeah.
when it comes to children and obesity, what are some of the kind of the health problems that you've seen in children that are obese?
Well, some are obvious, but some are not so obvious. For example, we know that it can lead to diabetes, and even in children, teenagers are sometimes getting type 2 diabetes. Um, but some of the not so obvious, there are some conditions that happen in children that are directly related to obesity. So some orthopedic problems that I recently had a patient that was diagnosed with a hip problem, and that hip problem is it was due to his obesity in this case.
Mm-hmm.
And so sometimes there's those are things that the general public doesn't know as much about. So in addition to your typical problems of blood pressure, I do see a lot of high blood pressure in kids,
Mm-hmm.
surprisingly high amount,
Mm-hmm.
and diabetes. But there are those other things that aren't as obvious. And parents need to know, wow, this could really impact even their bones, their hips in this case. And so I do see, and I see it worsening some regular problems. There are plenty of kids who have asthma, and they have, other chronic health conditions that are pretty common in childhood, but obesity can make that worse too.
Mm, yeah, exactly. So when it comes to looking at an integrative approach, a more holistic approach, how is that different? Or why would somebody maybe consider looking for someone with those kind of titles and letters and information when they're looking for a pediatrician, or even looking for themselves as adults? I know adults are looking for this as well. Why would somebody want to, look more into and be open to that versus traditional, what we have had going on?
Right. And one thing about pediatrics is I think it lends itself to integrative medicine very well, because just in general, pediatricians are very much into prevention and into
Mhm.
healthy lifestyles. And so a lot of what I do is very just bread and butter pediatrics, is what I like to say. So, but integrative and holistic really means kind of getting to the root cause and trying to use those um, lifestyle changes to bring about healthy living. And it's really about, to me, self empowerment. These are all things you can do, which is what I think is what attracted me most to integrative medicine. This idea of, wow, these are things I do, my choices that I can do to improve my health. So I think, a lot of people want that. They want to know, what can I do? And there's a lot you can do. So the integrative approach, it's really, like we said, about lifestyle and environment, what you're eating. And specifically, very much about more so what you are eating than what not to eat. I like to focus on what you should eat, because we always think about, okay, well, I'm not supposed to eat chips and I shouldn't eat so much candy. But what should you eat to really give you all of the vitamins and the minerals? One thing I like to use with my teenagers, I give them the example of a cell phone. And I say, have you ever let your cell phone get down to a very low level where it's just about to run out of batteries? Everybody's had that experience, right?
Yeah.
Well, what's happening is that your cell phone is still working. If you get a call, it'll come through. If you get a text, it'll come through. But there's a lot of background stuff that's no longer activated. And so it's working on very low reserves. And therefore, there's a lot that you can't do on your phone once it gets low like that. And my point to my kids is, if you are constantly, if you are chronically not eating foods that
Mm,
contain vitamins and minerals, your body is doing things in the background that you're not aware of that are
mhm,
setting you up for dysfunction. And
mm.
so you have to be putting those vitamins, minerals, plant, phytonutrients, all of that has to go in. And that's what we focus on as integrative holistic physicians.
Mhm. Oh, I love it. That is a great analogy. That's really great way to think about it, especially with kids now and
Yeah.
technology. That's absolutely perfect way to think about it. Thank you for sharing that. That's definitely something that I think somebody can take and put into practice because that's what I love. I love sharing things that you can do right now, right now when you're watching this and put that into practice in your day because that's so powerful. And the empowerment part about what you talked about. And that's why I love what I do too is, you are your best advocate. You are the only one that can take your health into your hands to save your life. You are the only one that can do the things. People can tell you to do all these things all day long, but unless you do them, then what's the point? So I love that you empower yourself and you're your best advocate and using food as medicine and nutrition, and that's such the way to go, and changing your mindset around, well, I can't eat this and I can't do this and I can't do this. No, it's you can do all these other things,
Yeah.
all these other things that have nothing to do with medication or with restriction or with any of that other kind of stuff. You can do all these things to serve your body, to fuel your body, to heal your body in a natural way with your lifestyle, with the foods that you eat. And I think for children too, it's such a great way to start, um, being a positive, because this could be a whole nother topic for a whole nother show, but the influences that they have on them. And, your family is one of your biggest influences. And what are we influencing the kids with? And again, going back to environment, that's such a huge thing too. So I think that's another huge takeaway from today is one thing that you can do while you're listening to this, whenever and however you're listening to this session today, is look at your environment. Take a really close eye, audit your environment, look at it. Is it serving you or is it setting you up to continue this lifestyle and this issue that you have? And for kids and adults, that is absolutely the fact. So thank you for all of that. I love that. And one final thing, how do you kind of view the healthcare team? Is it just you trying to implement all these things on your own, or do you suggest parents, utilizing different people in the healthcare team? What do you think about that?
Yeah, absolutely. So a lot of times, there one thing that's good, that's available is the nutritionists and even the weight programs that are designed for kids to help them through when there's really a weight issue and we really need to lose weight, then there are a lot of programs. So I do like to use a team approach.
Mhm,
Sometimes that involves a registered dietitian. Sometimes that involves one of the programs like Weight Smart, for example. And there are quite a few that have different titles, but that's one of the more well-known ones. And we send them there to where they can do more intensive therapy. They can really teach about nutrition. They can really follow blood levels, things like that, because
mhm,
they're not going to see me as their pediatrician very often. Even if we check in every 3 months or so, that's still a lot of time in between. But
mhm,
a dietitian or a Weight Smart program type of Weight Smart type of program can see them every week or every couple weeks and really reinforce that message
mhm,
regularly, consistently. And so definitely I try to use whatever other resources are available for them.
mhm. Oh, I love that. So, we were talking before too that you have some books in the works and you've written some books, and I just like to let people know where they can find you and what kind of things you have going on and what other things you've put out into the world. So, would you tell us?
Great, sure. I did write a book about, as I was going through this journey 10 years ago, the way I approached learning about integrative or holistic health was I was learning about the different components of it. And I did it as a workshop at my church. I was actually every month saying, let's work on one thing. And it became a title, Change One Thing. And so what I eventually did was wrote a book called Change One Thing. And it's basically one thing at a time. You work on one habit every month for a year. And that involves the things we know are the bedrocks of health. So drinking adequate water, getting adequate sleep. It talks about stress, talks about exercise, all of those. It's 12 different things. And so that book is called Change One Thing. It's available on Amazon. And and I have, social media. I try to put out information every few days about just healthy living in general. I usually focus on something. So I might be focusing on a certain fitness topic or certain, illness that, what's the holistic approach to that. So I'm on Facebook and Instagram and Twitter as Dr. Teresa Fuller. And that's where I usually put my health information out.
Oh, I love that. And such great information. And I love that you come from, a personal experience as well, like a lived experience. And now you're sharing all of that with the world. So I love that. Well, thank you, Dr. T, so much. And as always, this video is going to be it's going to be on everywhere. It's being streamed everywhere. So if you catch it live or hashtag replay, definitely let us know. Still drop your questions because you'll have availability to both of us. And I'll upload this later on as a podcast so we can all listen to it. So thank you again so much. Definitely connect with Dr. T. Definitely connect with me. I always leave my links. I'm on all the socials as well as Dr. Alex Rosa. And that's all I have today for In Your Business with Dr. Alex. And thank you, Dr. T, so much for being here.
Dr. Alex.
All right, everybody, take care. And like I always say, for a balanced life, just as